Hello, dear colleagues. Welcome and thank you for joining this webinar. I hope all of you are staying safe and healthy. My name is Özgür Erdogan. I am an oral and maxillofacial surgeon based in Istanbul, Turkey. The topic of my presentation today is sinus floor elevation, management of complications. Before starting my presentation, I would like to thank the ITI, International Team for Implantology, Straumann Group and Dental Tribune for giving me this opportunity to be here with you today and facilitating this great scientific event. Regarding my affiliations, I'm a full-time faculty at Istanbul Okan University, Faculty of Dentistry, which is located at the Asian side of Istanbul. This photograph above shows Bosphorus, a sea that divides Istanbul into European and Asian parts. The photographs below are the medical hospital and dental hospital buildings where I perform my surgeries. Other than this, I am an ITI fellow and a member of the ITI since almost 15 years. The images used in this presentation are either my cases or they belong to my colleagues with whom I work together at the same department. And some images are retrieved from the ITI Treatment Guide, Volume 5, which is a book from the ITI Treatment Guide book series, which cover a lot of many topics in dental implantology. When it comes to sinus floor elevation, I think two names have to be acknowledged all the time. The technique has been invented and introduced by Dr. Oscar Tatum in mid-70s. He presented this case for the first time in a conference at Alabama in 1976. But we also know that Dr. Philip Boyen, a maxillofacial surgeon from the US, was also performing these procedures in 70s. And his group was, in fact, the first people who published this technique in a peer-reviewed journal.